What is going on, people? It's Medicosis Perfectionalis, where medicine makes perfect sense. Let's continue our playlist called Rheumatology. In previous videos in this playlist, we talked about scleroderma, the pathogenesis of scleroderma, the symptoms of systemic sclerosis, how to diagnose, and how to manage this disease. Today is just a comparison between the limited type of scleroderma and the diffuse type. With that said, now let's get started. The videos in this playlist are to be watched in order for maximum retention and flow. Sounds like I'm talking about my urinary bladder. Systemic sclerosis in brief, or in a nutshell. Scleroderma is a disease of an unknown etiology. It's probably autoimmune, more common in women than men. Collagen problems, lots of fibrosis, lots of sclerosis, hardening. That's why it's called scleroderma. Sclero, hard, derma, skin. My skin is so hard and so tight. The new name is not scleroderma, but systemic sclerosis. Why did they change it? Because they realized that it's not peculiar to the skin. I can have symptoms anywhere in the body, including respiratory disease, kidney disease, heart disease, esophageal disease, etc. We have many types of scleroderma. The most famous two are the diffuse and the limited, which is today's topic. The most common initial finding is Raynaud's phenomena in the skin. My skin is red, white, and blue. The most frequently targeted organ in this disease is the skin. The most common cause of death is respiratory failure. Don't forget that ACE inhibitors work like magic in scleroderma nephrosis. Here are the subtypes of systemic sclerosis. There are gazillions. The most famous ones are 5, including diffuse cutaneous systemic sclerosis, limited cutaneous systemic sclerosis, localized systemic sclerosis, and systemic sclerosis sign scleroderma, which means I have the systemic disease without the skin involvement. And just like rheumatoid arthritis can overlap with lupus, and we call it rupus, systemic sclerosis can also overlap with other rheumatological conditions. Today, we're comparing between this doofus and that doofus. Diffuse cutaneous versus limited cutaneous systemic sclerosis. The limited cutaneous has another name, CREST, which is a beautiful acronym. What's the C? Calcinosis. What's the R? Raynaud's phenomenon. What's the E? Esophageal dysmotility. How about the S? Sclerodactyly. And the T is telangiectasia. Diffuse cutaneous is diffuse. What do you mean? Most of my skin. Oh, lots of areas. But here the skin thickening is limited to a certain location, e.g. distal to the elbows and knees. Patients with diffuse cutaneous systemic sclerosis have a higher risk of multi-organ involvement as contrasted to those with CREST syndrome. Diffuse affects my skin proximally and distally, but in limited it's distal only. Visceral involvement happen early in diffuse cutaneous, but in limited cutaneous, the visceral involvement, such as the esophageal dysmotility, happen later. What kind of antibodies can I see in the serum of the patient with the disease? In diffuse, you can see anti-RNA polymerase 3, aka anti-RNA pol 3, or anti-DNA topoisomerase 1, aka anti-scleroderma 70, which is horrible because it's associated with scleroderma renal crisis. How about anti-RNA polymerase 3? It could be related to pulmonary involvement. In CREST syndrome, I see anti-centromere antibodies, which also fit with the C. So you can remember the C for calcinosis and the C for the anti-centromere antibody. Tell me about my kidney. Diffuse cutaneous can suffer from scleroderma renal crisis, but this does not happen most of the time in CREST syndrome. Very unlikely. Tell me about the lungs. In diffuse cutaneous, it's interstitial lung disease. What do you mean? Interstitial pulmonary fibrosis. Oh, a restrictive lung disease then. That's true. All of my volumes or capacities are low, right? Yes. The only thing that is raised is the ratio. What ratio? FEV1 to FVC ratio. The lung disease in limited cutaneous systemic sclerosis is in the pulmonary arteries, in the form of pulmonary hypertension. If you like this video, you will also adore my antibiotics course to learn about antibacterials, antifungals, antivirals, and antiparasitic medications available to download at medicosisperfectionalis.com. I also have a toxicology course and 10 other courses at least. And here's where medicosis shines, my acid-base imbalance course. There is nothing like it on the face of the planet. This topic is poorly understood by most doctors, and don't get me started on surgeons.
But hey, medicosis, surgeons are doctors too.
Yeah, but I consider them butchers. Thank you for watching. Please subscribe, hit the bell, and click on the join button. You can support me here or here. Go to my website to download my courses. Be safe, stay happy, study hard. This is Medicosis Perfectionalis, where medicine makes perfect sense.